Okay, now I'm going to start the webinar and get us all started. Welcome, everyone. We're excited to have you all with us today for our workshop, Rapid Recovery from Anxiety and Shame with CBT legend Dr. David Burns. And I am super excited to be co-hosting this webinar for therapists and the general public with David Burns today. I'm going to do some introductions and also get to know who our audience is a little bit as we get started. And then we'll get going with sharing a really beautiful story and therapy with you. So let me run this poll. Actually, it's a quick poll where we're going to ask you guys who you are so that we know how many of you are joining us as members of the general public and how many of you are joining us as therapists. So I'm going to give you a minute to just click your answer to that poll, and then I'll share the results.
Yeah, the results are totally unexpected and interesting.
And rather than entering in the chat box, just enter in the poll. So I'll give you guys about 10 more seconds. About most of you have responded. So I will go ahead and end the poll and share the results. So 80% of you who've joined us today are therapists, and 20% of you are joining us from the general public. So let me now introduce to you guys our wonderful presenter here, David Burns. So I probably don't need to introduce David, but as you all know, David is a world-renowned psychiatrist. He's one of the founders of cognitive behavioral therapy way back in the day with Aaron Beck. He's a CBT legend, he's a best-selling author, and he's also more recently the creator of a really amazing app called the Feeling Great app that David's going to share more information with everyone about toward the end of the workshop today. I'm also going to tell you guys just a little bit about Feeling Good Institute as we get started. So we're global leaders in CBT treatment, training, and certification. So our mission is kind of twofold. It's to train and certify therapists in TEAM-CBT, and then also to help patients. And our goal is to help patients get better by creating really phenomenal, top-notch therapists. So Feeling Good Institute was founded by myself, Maor Katz, and Angela Crum, all of whom had trained with David many years ago back at Stanford. And our mission is to alleviate suffering by really elevating the practice of therapy. And really, it's to take the amazing work that we learned from David and find a way to share it more widely to make therapists better and to help patients. Our goal is not only to share with therapists the tools and techniques that we learned from David, but also to replicate his training style, which is based on the idea that the only way to become a better therapist is to practice and get feedback. And to say a little bit more about that, we actually know that experience alone is not what makes therapists better, that the more we practice therapy, we're not necessarily going to get better. What we need to do is learn and practice and get feedback. That experience alone does not improve therapy skills. And so what I've learned from training with David is that we teach, we demonstrate, and then we practice as therapists, and that's the way that we can get better. And so I kind of have a little teaser question here for those therapists in the audience, which is, I want you to ask yourself, do you want to become a better therapist? Are you willing to put time and energy into training and practicing so that you can become a better therapist? And I'm guessing that the answer to this question is yes, or you probably wouldn't be here today. And so at the end of the session today, we'll share with you kind of a program that we've developed to help therapists become even better. And that's through training and practice. And we'll share with you the fast track course that we've created so that you can do that. And I will share that when I first met David and started training with David, which was more than 17 years ago, kind of the only way to become TEAM-CBT certified or TEAM-CBT trained was with David at Stanford and with some of David's intensives around the country and around the world. And so we're excited that we've created a kind of efficient and fast way for people to learn kind of the amazing skills that David's taught all of us. And that's what the Fast Track course is all about. And so I will kind of begin the main content by going over kind of the team framework that David's created. And then I'll turn things over to David to tell you about some special work that we did with a beloved colleague, Melanie. So you can see on the screen here the team framework, which TEAM-CBT stands for Testing, Empathy, Assessment of Resistance, and Methods. But really, I want you to think of it as a framework for doing effective therapy that really takes the strongest predictors of successful therapy or treatment outcome and puts it into kind of a replicable kind of package. And TEAM-CBT is effective for a whole range of things, for anxiety, depression, OCD, trauma, habits, addictions. And the beauty of it is that it's a framework that you can follow kind of regardless of what you're treating. And so I want to say a little bit more about it, which is that the T in TEAM stands for testing. That's measurement, that we use measures at the beginning and end of every session with every patient in order to track progress over time, in order to make sure that we're seeing the gains that we want, and in order to check in with our patient and see how they're perceiving us so that we can address ruptures in the alliance. And you're going to see the measurement or the testing that we use with Melanie today. And the E in TEAM stands for empathy. And that is that we use empathy skills that we've learned from David to make sure that we're connecting with our patients, that we're addressing alliance ruptures right off the bat, and that we're not just throwing powerful methods at our patients, but really taking time to connect with them and to understand them. And the A in TEAM stands for assessment of resistance. That is that we're going to address potential resistance. We're going to melt it away, and we're going to boost motivation before coming in with the kind of powerful methods. And then the M in TEAM stands for methods, and we'll be sharing with you several methods today. Kind of what I want you to take away from this slide then is that TEAM is this framework that you can learn and that you can replicate with all of your patients. And to help you do that a little bit, you'll see there's a little team icon that we've added to the slides today, so you can follow along and see where we are in the team framework. So now I'll let David take over and kind of get to the fun part here.
Sure. A number of years ago, I had the chance to have some sessions recorded on video for training purposes, and we had two actual television cameramen set up in our living room, and I asked people in our Tuesday training group if you'd care to do a live session, and we do video it, and if you give permission, we'd like to use it for training. And a number of people volunteered, and the first person on the first day was Melanie, who was a beloved member of our Tuesday group for a couple of years. And I had no idea that, what in the world would she ever need a session for, because she seems like the most loving and joyous and confident and beautiful person imaginable. But it turned out that she had been struggling for more than a decade in intense shame and anxiety because she was covering up something about her past that she thought was terrible. And I think all of us, when we think about our own failures and shortcomings, we tend to think, "Oh, this is just awful. And if anyone knew this about me, they'd really judge me." And that was her fear, and she believed with all her hearts that she was not only a failure, but she was defective. Now, as you know, when we're working with somebody, I always start with a specific moment when you were upset, because that's because all of your suffering will typically be encapsulated in any 1, 5, or 10 seconds when you're upset. And so to understand your suffering, many, many sessions going into your childhood and so forth is usually not necessary. But if you really understand what's going on at a brief moment, you'll have all the understanding. And we call that fractal psychotherapy. A fractal is a little tiny thing in nature that repeats itself, a little equation that repeats itself over and over again. And that's how trees make leaves. That's how a lot of things grow. That's how forests develop, by some simple thing being repeated over and over again. And what Melanie said was upsetting her was she got a call from a member of her church, a woman expressing condolences over the death of her mother-in-law. And after Melanie said that, she said, "But I have to confess to you, David, that my tears," and she began crying, "are not because of the death of my mother-in-law. You see, my mother-in-law didn't actually die. It was my ex-mother-in-law. And to tell you the truth, I've had 2 failed marriages, and I've been trying to hide it for fear that people would judge me. And I can be happy maybe with I'm in my 3rd marriage. It's a wonderful marriage. I finally found my knight in shining armor, and I couldn't be happier. Except, let's say we're out with another couple. I forget about my failed marriages, and I'm feeling good, and then it hits me like lightning. Oh, my gosh, what if they find out I've had 2 failed marriages? And this was just almost unbearably shameful for her. And also, she was a beautiful woman, always doing for others. She was the head of the couples counseling, a free thing that she was doing in her church, helping troubled couples. But she was telling herself, "Oh my gosh, I must be a fraud. How can I help troubled couples if I can't even make my own marriages work?" And also, what was especially sad to me is that Melanie was not only a great therapist, she was a great teacher working at here at just down the road from where I live at the local community college. And she often went to East Palo Alto and did a lot of outreach work for people with limited resources. And she had many awards that she would get, and often there would be a ceremony, and the mayor would be giving her some civic award, and there'd be hundreds of people in the audience. And Melanie said that she hides her awards in her closet of her office. And then I often ask people, why do you think she hides these awards? And people say, oh, because she's depressed and she thinks she doesn't deserve them. But that's not why. She thinks she does deserve them, and she's proud of them. But she's terrified that a student or colleague will come into her office, and if she puts all these amazing awards on her wall, and they'll say, "Oh, Melanie, look at all these civic awards you've received for teaching and public outreach work. That's wonderful. But what are all these last names on your awards, Melanie? You haven't had a bunch of marriages, have you?" And that's kind of like the worst fantasy. And I felt so sad that Melanie has given so much, and she's afraid even to show some of the benefits and awards that she's so richly deserved. Um, so we can push on to the next slide. Now, as you know, one of the mandatory things, and it's a blessing but frightening to therapists, is that we require everyone doing team therapy to measure your patient's symptoms with brief, highly accurate scales. How are you feeling at this moment? And do that at the start and end of every therapy session, so you can see exactly how your patient is feeling at the start and exactly how your patient is feeling at the end. And then you see how effective you were or won't. And that's the secret sauce of team therapy. Most therapists do not and will not use assessment scales, wrongly and foolishly thinking that they don't need them, that they already know how their patients feel. And this is a huge mistake because I've done research at the Stanford Hospital in the inpatient unit on how patients feel and how experts who have been interviewing them for 2 or 3 hours shortly after admission on how they feel. And after to make DSM diagnoses, it's called the SKID diagnostic interview. It's the gold standard, so to speak. And then after they interviewed like 100 and over 100 newly admitted patients, then they didn't know I was going to do this, but I had the patient and therapist turn their backs to each other and then fill out my brief mood survey. The patient fills it out. How are you feeling right now? How depressed are you? How suicidal are you? How anxious are you? How angry are you? Things like that. The therapist fills out exactly the same scale, guessing the patient's feelings because they've just been talking to the patient about their feelings for 2 or 3 hours straight. And so now, how is the patient feeling? It's a simple question. And also, these patients rated the expert interviewing them on warmth and empathy and understanding, and the experts rated themselves on the same scale, guessing how they think the patient will rate them. And the shocking thing, then I was able to put the data in a computer and find out the accuracy of therapists in all kinds of dimensions. How accurate are you in your understanding of depression? And you're picking up if somebody's suicidal, on your understanding of anxiety, of anger, of positive feelings, and empathy. How good are you at knowing the therapeutic alliance, sensing how you're coming across to someone? And the shocking results, to make a long story short, was that everything was less than 10% accuracy. Empathy was only 9% accurate, meaning that they had almost no correct understanding of how the patient felt about them. Depression was 3%. Can you imagine spending 3 hours talking to someone about their depression and still not being able to know how depressed they are when they're right in front of you at that very moment? It was surprising and shocking. Suicide was 0% accuracy. Wow. What are the implications of that? You don't know how suicidal your patient is, but you probably think you know, but you don't. Your hunches are very unlikely to be valid. That could cost a patient their life. Anger was 0% accurate, and anxiety was like 5% or something like that. Uh, the uh, the good news is if you use these instruments, you will wake up from the trance you're in and begin to see reality as it is, your patients as they are, and get information that you can use to fine-tune your practice. Why is Steph Curry such a great basketball player? If you live in the Bay Area here, you know who he is. He's the greatest shooter of all time. And the reason is because every time he shoots the ball, and this is true of all basketball players, you can see when it goes through the hoop and use that to adjust what you're doing. But therapists don't do that. That's why you can't improve. Someone put a question: where's the evidence that therapists don't improve? Well, I don't know the article. Maybe Joel and them can tell you what article they're citing. But this is the reason why, because we're not measuring things, and so you're in a dream world, not knowing when you're failing, and when you're succeeding. Well, these were Melanie's initial mood scores. Her depression was 50 on a 0 to 100 scale. 100 is the worst possible. Anxiety was 100. Shame was 100. The most intense anxiety and shame a human being can experience. Defectiveness, 80%. Embarrassed, 100%. Hopeless, only 25%. That was certainly a good sign there. But frustration and anger, 75 to 80%. And as I say, it's proof of how we can't know. If I had guessed these, if anyone had guessed how she was feeling, we would have all put her 5 to 10 or 0 on all of these. But her scores were as high as many people on an inpatient psychiatric unit. Okay, next
And
And
David, I
now,
was also just going to comment. A couple people were asking what the scales were, and I wanted to say these were actually her scores on her daily mood log, which you'll see in a moment. So it's not that we administered a defectiveness scale or an embarrassment scale. People were
oh
asking
yeah,
about
good
that,
point.
but
Yeah,
rather these were her initial scores on her daily mood log, which you'll see, shortly.
yeah, yeah, right. Yeah, here is the daily mood log, and here are those scores. And the upsetting event was a call from a church member. Here's her emotions in 8 different dimensions, all of them elevated, and most of them extremely severe. And then what causes these feelings? Well, the cognitive idea is that your thoughts trigger your feelings. That's been speculated about for the last nearly 2,000 years since Epictetus first made this claim. And we are about to publish a research article where we believe we've found proof of that statistically for the first time in our app users. But at any rate, Melanie was telling herself, NT is negative thoughts. I'm a failure. And yet to be upset, you have to have a negative thought and believe it. And her belief in that was 100%. And she was telling herself, she'll tell other people who will judge me, 100%. I'm defective, 85%. People will think I can't maintain relationships. She believes that 95%. People will think that men dump me, 65%. And she had many additional negative thoughts as well. And one thing I love about asking patients about their negative thoughts is we all have our own unique negative thoughts. And here it allows you to treat the individual in front of you rather than doing some cookbook therapy based on a DSM diagnosis and then some, potentially, validated treatment recipe. And although the validated treatment recipes have, some value, this allows you to absolutely personalize your interventions for the thoughts that are troubling each patient you're seeing. Now,
Sorry, I just clicked ahead. Yeah,
okay,
I can comment on this, which is that we are kind of moving through the team model. We talked about testing where we can really understand how Melanie is doing at the beginning of the session through the measures, through the daily mood log. And then next in the team model, we go to empathy. And actually, we kind of start with empathy. It's always a part of testing as well. But David's developed kind of an empathy toolbox that's called the 5 Secrets of Effective Communication. And we won't go through all of that with you, but just want to express that empathy, connection, listening before jumping in is vitally important to creating a warm and trusting therapeutic relationship. In fact, many of the methods that you'll see us do today are role playing methods, and they can even be a bit aggressive or confrontational in a way. And so, in order for us to be able to do those kinds of powerful methods with our patients, we really need to lead with empathy. And at the same time, while empathy is enormously important and necessary, it's not sufficient for bringing about change. So empathy alone is not going to cure much of anything, and powerful techniques are also needed. And so we won't be showing you excerpts, but suffice it to say that we spent time really listening to Melanie and understanding her and providing her with lots of warmth and support. You want me to keep going, or you want to pick up here, David?
okay. Well, I'll pick up
Great.
again. You're doing great. You always do fantastic. But before we try to help Melanie or any patient, we deal with 2 forms of resistance, and Freud spent his life trying to understand resistance and trying to find some method to reduce resistance. And I developed the concept of outcome and process resistance for each of 4 targets: depression, anxiety, relationship problems, or habits and addictions. And the outcome resistance does the patient, in this case, Melanie, really want the outcome she says she wants? And do you really want the outcome you say you want if you're going to therapy? I asked her toward the end of the empathy, if your dream came true in this session today, was, just fantastic. What would happen by the end? And she wanted her anxiety and shame to disappear so she could relax and not be constantly worrying about people finding out about her and judging her. And then that's outcome resistance. She wants to feel happiness and joy and maybe crush these negative thoughts and reduce these negative feelings dramatically if possible. That's outcome resistance would mean she says she wants that, but might she fight us? And if you're a therapist, do some of your patients fight you? And yes, but you when you try to help them and you get frustrated and say, well, patient's asking for help with panic attacks. I'm trying to show her how to get over panic attacks, and she's yes butting me and putting up a wall. And how do we bring that wall to conscious awareness and melt it away? And then process resistance is a little different. Maybe the patient, or maybe you, if you're the patient, do want a positive outcome, but are you willing to participate in the process to make that happen? And in Melanie's case, there are two processes she may have to do. One is to do her homework between therapy sessions, to write down her negative thoughts just on that daily mood log, identify the distortions in them and challenge them on an ongoing basis, and to do other things that we ask her to do between therapy sessions to accelerate her progress. And also, since she has tremendous anxiety, the process issue there will be courage. Is she willing to use exposure, and instead of hiding these her secrets, that's the hiding that causes the shame, is she willing to open up and tell people the truth about herself and let the chips fall where they may?
And the reason that we put on here, are you willing to do the work to get better, is just that we realize some of you are joining us from the general public and may be interested in how do I use these methods on myself. And so as we're walking through the the phases with Melanie, you might be asking yourself, yeah, do I really want the outcome that I say I want? Why not? Why might I actually want to stay the same? And am I willing to engage in the process that I'm going to need to engage in order to get better, right? Whether that's depression or anxiety. And then we say that these methods that David's just talking about, process resistance and outcome resistance, you said testing was the secret sauce, David, but we also say that agenda setting is the secret sauce, meaning it's kind of the necessary ingredient to help people to get better. And that is this idea of addressing resistance. And not only are the methods in and of themselves really helpful in boosting motivation and melting away resistance, but they also are very much focused on helping patients to feel proud of their symptoms, right? We want to be, you'll see us, but we're going to be thinking, how does Melanie's shame show us actually something incredibly beautiful about her? And can we help Melanie turn these feelings, these negative emotions actually into sources of pride?
And this is also one of the dimensions that my research in the last, 40 or 45 years on how people change revealed that the cognitive therapy was always good, but about 50% of the patients in outcome studies and in clinical settings don't respond. And I discovered that the reason for therapeutic failure, most of the time, even 95 or more percent of the time, is because there is subconscious resistance that has not been dealt with effectively. And so my colleagues and I have developed about 20 new innovative techniques to bring the resistance to conscious awareness and then melt it away. And that raised the recovery rate, in my experience, dramatically, because once I refined this, I found my patients getting better, not most of the time in 10 to 20 therapy sessions, which was great in the early days of cognitive therapy. In fact, it was a breakthrough back in, when 1980, when Feeling Good came out. But now, when I see people, or when Jill and I work together, like on Melanie today, almost, a good 90% of the time, we see virtually a complete elimination of symptoms in one single 2-hour therapy session. And then you want to do some relapse prevention after that. And there may be some loose ends to attend to, or there may not. But this paradoxical agenda setting is missing from many, if not most, schools of therapy. And it's really what opens the door to dramatic, rapid recovery.
And we're going to share with you what that looks like now, right? What are the steps for this paradoxical agenda setting and kind of how it went with Melanie? So the first question that we ask people is we say, if, imagine that there was a magic button on my desk or right in front of you, and if you could press that magic button and all of your negative thoughts and feelings would instantly disappear. You would, right now, without any effort whatsoever, you'd feel joy and self-esteem. Would you press that button? And of course, most people are going to say, yes, show me the button. Where's the button? And then our response is something along the lines of we don't actually have a magic button, but we do have some really great tools and techniques. And there's a really great chance that we will make those negative thoughts and feelings disappear. But actually, I can think that there might be some good reasons to hang on to some of your negative emotions, some reasons to continue to feel anxious or depressed or to hold on to that shame. And can we talk for a few minutes about that? Can we think about that together? And that's what leads to this method that David's developed that's called positive reframing. And in positive reframing, we're asking the patient to think about, and in this case, Melanie, to think about why are her negative thoughts and feelings appropriate? And what are some benefits or advantages of each of her negative thoughts and feelings? And what do her negative thoughts and feelings show about her and her core values that's really positive, awesome, and beautiful? And so this is kind of easy to hear, but hard to understand and hard to grasp. And so we're actually going to show you a few of them, and then we're going to invite you to try to think through a few and do this exercise with us to see if we can uncover some of what Melanie's thoughts and feelings show about her that are beautiful and awesome and how they're actually working for her. Do you want to talk about this one, David?
Oh, sure. And we're going to try to make this easy for you because initially, even when seasoned therapists try to do positive reframing, they draw a blank. And because you see, we're trained, I was trained, and I think most of you were trained. If somebody is depressed, that's due to a chemical imbalance in the brain, which used to be thought. That theory has now been shown to be false. But that there's some defect in the patient's brain and that they need to be fixed. And that's all in our culture. In fact, one of Melanie's negative thoughts was, I must be defective. And so instead we're saying, Melanie, what is beautiful and awesome about your feelings of sadness and depression? And how might those feelings be helpful to you? And we're going to ask those questions about all of her negative feelings. We won't go through the whole list today and all of her thoughts, but it really wakens up a part of the patient's brain that's currently asleep. And we could get a list of 2 or 3 or 4, sometimes 5 or more overpowering positives about every negative feelings, but we'll just show you the tip of the iceberg. One thing, her sadness and depression shows Melanie's tenderness about her 2 broken marriages. A lot of people who've had failed marriages feel bitter and blaming and angry and spiteful and revengeful. But Melanie doesn't show, spitefulness and a sharp edge to her soul or to her personality. She shows warmth and compassion. And sometimes healthy sadness gives us a greater feeling of compassion for the suffering of others as well as ourselves. And then Melanie's up to 100% anxious, the most anxious and panicky a human being can be. Much of her life for the past 9-10 years has been struggling with incredible anxiety. But how would that be beneficial? Well, one thing is that her anxiety keeps her vigilant. So for two reasons. So she won't just blurt out, "I've had two failed marriages," and then have everyone judge her. That's a self-protection or self-love piece. But also it makes her vigilant so she can make sure her third marriage is a success. And she was very, very proud of her relationship, now 9 years, with her third husband, and all that she learned both from her failures as well as from her now highly successful and loving third marriage. And then shame. How could there be any good about shame? And someone on the question list said, "How does shame differ from embarrassment?" Well, I don't actually know. They're pretty much just about synonyms, and the shame means I'm afraid others are going to find out about me and judge me. I guess shame is when you're still keeping it hidden, and embarrassment is when you've done something screwy, in public. And so others are looking at you, and then you feel embarrassment. Um, but what's great about her shame? Well, you see, Melanie's shame is a direct expression of her profound spiritual respect for other people, as well as her love for the institution of marriage. You see, her shame is an announcement to herself and to the world. I love marriage and the values that go with loving families and loving relationships.
Sorry. I just clicked accidentally. Sorry about that.
Okay, okay. Um,
And
uh,
so
and
this
that,
one, David, we were going to invite the audience to do with us as an exercise. And
yeah,
so we kind of gave you, we started to get the juices flowing, I hope. But now we want you to think, what do Melanie's feelings of defectiveness and inadequacy show about her that's really beautiful and awesome? And you can enter it in the chat box. And Mike's
yeah,
going to read those
yeah,
aloud.
and ask yourself two questions. You say, she feels defective. Well, I got to fix her. I've got to give her an antidepressant or something. That's bad to feel defective and inadequate. But what we're saying is what's beautiful about defectiveness and inadequacy, and ask yourself first, how do those feelings help her? And second, and perhaps more important, certainly equally important, is what do those feelings show about Melanie and her core values as a human being that's positive, beautiful, or even awesome? And of course, if you're a therapist or the general public, one thing we're hoping you'll take out of today's program is what are your feelings of inadequacy or defectiveness or panic or rage or loneliness or whatever they might be show about you that's positive and awesome. Show about you and your core values as a human being. And how might those feelings be helping you?
They're
So
just
let us know what you think. Put
they're
your
just
guesses in
flying
the
in here,
chat.
David, and it seems like they're right on track. She appears to be striving for excellence. She wants things to improve. She may be motivated
Beautiful.
to change. She has a high
Yeah,
standard for herself.
right.
She wants to be more helpful, to be effective.
Yeah,
Um, Perhaps a reflection of her own demand for human perfection. Her high standards again shows her humility, motivates her. Um, High standards has coming up quite a few times. Humility, a willingness to grow, and it may motivate her to work harder on her current marriage.
yeah,
And
yeah,
so before I reveal the answer, so yeah, you guys are all getting into it. It's this idea that rather than buying into this idea that feeling defective is terrible and feeling inadequate is terrible, we're going to kind of honor these feelings and really connect with Melanie in a collaborative way about what these feelings show about her. That's beautiful and awesome. It's sort of, David, we say shows what's right about you rather than what's wrong with you.
right. Yeah.
So
And
let me
and
show you guys what we came up with, which I think you all hit on pretty much all of these. Humility, Mike said, high standards, honesty about her flaws, and then maybe accountability, this idea that she's kind of holding herself accountable, that she's had
yeah,
these failed marriages and she's going to do it right
yeah,
this time.
yeah. And what I want to say here is this isn't a head trip. There's some intellectual thing. Well, if when you see the videos of Melanie, And if you knew Melanie, you know she's a manifestation of humility and kindness and warmth. And that value is expressed through defectiveness as well as her honesty and inadequacy. And what a beautiful thing is that. And the moment she's proud of being defective, uh, then recovery at that moment is just a stone's throw away. We need somewhat more than this positive reframing, but this positive reframing opens the door to magic, and typically rapid magic.
And we have one more exercise with a couple on this slide as well for you guys to get into it. So, what does Melanie's hopelessness show about her that's beautiful and awesome, or how is it helping her?
Yeah, and
So we
and
can,
when I was creating this system, hopelessness was the second hardest one for me to figure out. How could there be anything good about hopelessness? Becca says hopelessness is the worst feeling, the one that leads to suicide. But now let's look at the other side. What's positive and awesome about feeling hopeless? And what are some benefits of feeling hopeless?
so enter them in the chat box if you can think of benefits of hopelessness or how it shows her values.
There's a number coming in a lot saying, she's being realistic. There's longing for meaning. Um, it's a form of acceptance and living in the moment. Shows her honesty. There's another one. Hope is protection from disappointment.
Yeah. So we've got a lot on here. So let's do that one. And then that's what we came up with, that it protects her from disappointment. But all the things that Mike is suggesting are all
They're all good.
possibilities.
Yep.
Yeah, exactly. And the next one we want you guys to do now, you're going to shift from hopelessness and now do frustrated. What does her frustration show about her and her values system, and how might it be helping her?
This was the hardest one for me to figure out. In fact, I worked on it for, a month, and I couldn't think of anything good about frustration. And one day I was sitting in a coffee shop on Castro Street in Mountain View, and all these people were drinking, fancy coffee and working on their laptops. And I just said out loud, can anyone help me? I've been trying to figure out the positives and negative feelings, and I can't think of anything positive about frustration. If anyone can think of anything, please just shout it out. And then someone shouted it out, and I immediately saw the answer.
It sounds like you were frustrated with not being able to find it, and then the answer came.
Yeah, yeah,
People are
right.
saying that it can be motivating, help you to kind of look for solutions.
Yeah,
Shows a
yeah,
desire to gain knowledge, passion for change,
yeah,
motivation for change, search for
yeah,
answers.
yeah. And what the guy shouted out was, it shows you haven't given up on your goals.
Nice.
And I thought, wow, that is so cool. Because you see, my frustration with not knowing what was great about frustration kept me working on it. I hadn't given up on my goal. And you're not frustrated once you've given up.
Right.
Do you see? And so frustration, I said, yeah, that's some good shit. The Buddha said that all the time about frustration 2,500 years ago. He said, that's good shit.
And we have one more on this slide and one more for Mike to help us out with, and that's angry or mad. What does Melanie's anger and madness show about her that's beautiful and awesome, or how is it benefiting her? So work on that one now with us.
Shows passion. It can be empowering and energizing. A sense of fairness. Shows that she cares. Um, can be empowering, respect and boundaries,
Now,
assertiveness.
these are really great. And one thing I try to emphasize, and Jill as well, is to make it specific to the person, rather than a general head trip. And Melanie is mad and angry. And now one of the things she's afraid of is, if people find out that I failed, they're going to judge me. And could that be worth being angry about? Because I was raised in a very right wing Christian home. My father was a minister, and there was a lot of judgment going on. toward people who were different. And it made me angry. It was painful for me once I was old enough to realize that. And a lot of people are going to judge Melanie because she's had 2 failed marriages. And I think her sense of justice and fairness shows her willingness to stick up for herself, and just makes me love Melanie even more, and to feel angry with her, that this holier than thou idea that some people have, and sometimes in churches, that, we're the superior people, and we have the right standards, and we don't get divorced. And that will come in a little later in her treatment. You'll see an actual video on that.
And I'll just say one more thing before we move on from positive reframing, that when we do this with a patient, it's actually very collaborative. So
Yeah.
after we do that magic button, and then we say, yeah, before, I have tools to help you? Absolutely. But there might be some good reasons for you to hang on to some of these feelings, and they even show some beautiful things about you. Then we ask them, can you think of any? And, we sometimes the patient says, yeah, well, my anxiety is protecting me. We say, great, let's write that down. And we kind of go through each feeling and each thought collaboratively, so the therapist can make suggestions and see if they fit, and the patient can make suggestions. And together, we're kind of just discovering for this patient, not generically, but for this patient, why these feelings and these thoughts are really actually showing some beautiful things and quite useful for them. And so then after we do that whole kind of positive reframing, we've listed all the benefits and the beautiful qualities, then we say to the patient, given all these benefits, why in the world would you want to press that magic button? Why would you want to change?
Because if you press that button, all your negative thoughts and feelings will instantly disappear with no effort. But then all these beautiful things about you are going to go right down the toilet with your negative thoughts and feelings. Is that what you want? You want all these beautiful qualities to disappear?
And then oftentimes patients will argue for change, right? If we ask them, why would you want to change given all these benefits? They'll oftentimes say, because I'm suffering so much, like Melanie would say, because I just want to accept myself and be proud of my marriage, because I don't want to be terrified of people seeing my new last name. I don't want to be sad when people call me to connect with me in the church. But again, this is kind of a paradoxical exercise and a paradoxical question. And so then, as you can imagine, people have mixed feelings. There's part of them that really, really want to change, right? That's why Melanie's here. She doesn't want to suffer anymore. But there's part of her that realizes she doesn't want to throw all these things down the toilet, as David said, and get rid of all of these beautiful qualities. And so that's when we come in with what we call the magic dial. So we say, what if there was a bit of a compromise here? So instead of getting rid of your depression, your shame, and guilt completely, where everything needs to go to zero, what if we were to dial down your feelings to kind of just the right level that makes sense to you, where you'd no longer be suffering in the way that you are, but where you could hang on to some of these beautiful values and even some of the benefits? And then we're going to go through each of the feelings on the daily mood log and ask Melanie to say, what would be your goal? How down would you want to feel? What's kind of just the right level of anxiety? How much guilt and shame do you want to have? And that's what we put in the goal column on the daily mood log.
And you can see
that,
right? There's the emotions and the percent before. That's before we start the session. And then the goal column, and then we'll also do the percent after the session at the end. And you can see she wanted her sadness to go from 50 to 0. But she thought her anxiety could only go from 100 to 40. And patients sometimes do what I call reverse hypnosis. They try to hypnotize you into feeling as negative about themselves as they feel. And when she said 40%, she said, if my anxiety could go down to 40, and I don't believe it's possible that it could go that low because the problem is real, but she said that would be a miracle. And the lowest my shame could ever go was from 100 to 30. But she thought that it would be okay to get her inadequacy down from 95 to 10%. And her embarrassment and feeling foolish and humiliated from 100 to 30. And her hopelessness and frustration and anger, she wanted them all to go to zero. And so now what we've done is we've made a deal with her subconscious mind. She doesn't have to resist our efforts to help her change. And yes, but because she said, these are the levels I'd like to bring them to if possible. And so we're saying, okay, we've got a deal. We'll bring them down to these levels and no lower. And I sometimes even say to patients now, sometimes the techniques are so powerful, and your anxiety you could overshoot, and it might go down to 30 or 20 or all the way to 10. But don't worry about that, because if these feelings go too low, if you get too happy, will help you get more negative thoughts, so you can push them up to the desired level before the end of the session. And that usually brings some laughter to the patient, and the laughter itself, I think, can be quite healing.
And the beauty of the goal column, again, is that it's so individual. We're inviting the patient to recognize how much suffering their negative thoughts are causing them, but we're also allowing them to recognize the benefits of them and really to kind of make a decision, right? Like how anxious would you want to feel? How guilty? So in a way, the magic button seems like it's this binary black and white question, but actually we do that to get to kind of the beauty of the shades of gray, the beauty of the in-between, and again to melt away the resistance.
And one other point, the team, Jill and I make it look real easy. It's actually the most challenging form of therapy in the world to learn. I'm pretty sure. I don't think anything else comes close to it. And part of it is because it goes against our human nature. You see, we're operating now not as the therapist, but as Melanie's subconscious mind, her resistance. We're the part of her mind that is giving her all the good reasons not to change. You see, because all your negative feelings are beautiful. And at the end, reversing the positives, we say, are these, is this real? And every patient says, yes. Are these positives powerful? Yes. Are they important? Yes. So we're getting her to buy into how great her negative feelings are. And that's a paradox, because most therapists, the way I was trained, and I'm sure the way you were trained, was to try to be helpful. And we're doing the opposite. But it's an art form, and it has to be done with skill and compassion. And if done with skill and compassion, it's extraordinarily powerful. And it makes it actually impossible for patients to resist. A lot of us don't struggle with resistant patients. I can tell you that it's impossible for a patient to resist Jill or David. And it's nice to know that. It makes it much more relaxing to be a therapist. Resistance, Sigmund, has been solved.
And this is really the same thing, but just showed graphically, right, David? You can see her
Yeah.
initial scores on depression, anxiety, shame. This is all the ratings on the daily mood log, and then you can see kind of what her goals were. And so they varied from emotion to emotion, and for good reason. So this is just a summary where we wanted to highlight for you what we just went over. So we taught you the magic button and positive reframing, that pivot question, kind of given all these benefits. Why would you want to change? Why would you want to lose all these beautiful things? And that's kind of where the patient argues for change. And then the magic dial, where we actually come to, an agreement with the resistance, so that we can move forward.
Now I have a question. If you go back to that slide. Down in the left-hand corner, I see this little thing you promised, TEAM, and there's a red arrow pointing to the A. What does that mean, and how are these little icons helping us with the presentation?
Glad you asked, David. These icons are helping make sense of this process for everyone, so that you can see that we're in the agenda setting phase here, right? So we started with testing, and that was the arrow was at the T and testing. And then we had a slide talking about how important it is to connect and empathize. And now we're in agenda setting. And then when we move on to methods, you'll see the red arrow move down to methods. And that way you can kind of see where we are in this overall framework. And David, I think, well, what I'll say is this is almost a test to who was listening, because David actually mentioned the answer to this question earlier today. But we're not going to be teaching you our whole process resistance sequence, although there's, to me, a really mind-blowing sequence, equally awesome to the positive reframing, but for addressing process resistance. But the process resistance we're asking here is, let's imagine now we have Melanie saying, yes, I definitely want you to help me. I want to reduce these feelings. Here are my goals. Well, what is Melanie going to need to do? What is probably the hardest piece of therapy that Melanie is going to have to do that she's maybe not going to want to do in order to be cured? And I can handle this, Mike, because I can see the chat box and it's a quick one. But we have a bunch of people who were listening to you earlier, David, who are saying exposure. And some people also are saying homework, which is always true. But we oftentimes say the hardest thing for people with anxiety actually tend to love doing homework. They're really conscientious and great students and patients, but what is she going to have to do that she's not going to want to do? And someone specifically wrote in the chat box, tell people about her failed marriages, hang her awards proudly, be courageous. Yeah, so you guys got the hang of it.
We're just showing you a few video clips today, but we also have a video clip of when I asked her this question, what are you going to have to do to be cured? And then she says, exposure, and she grimaces and holds her hand over her face. But then she says, I guess I will. I'm willing to do that, which was a great sign and kind of a very inspiring moment too.
And some people put in the chat box things that she will need to do, like homework and like self-compassion and things like that. But the thing that she's not going to want to do is exposure, right? She's going to be happy to learn how to be more self-compassionate and to do homework. And that's going to feel relatively easy for her. But facing her fears, right, and overcoming her shame and embarrassment is going to be the tough part.
Telling people. Oh, curses, I'm foiled. Do I have to do that? Please, God,
right.
don't make me do that. Yeah. Now we're into the methods section, and this is the fourth phase of the therapy session. And we want to use methods to crush Melanie's negative thoughts. Now, we're always highly specific. We try to avoid bullshit and generalizations and crap like that nobody was ever helped by, except maybe philosophy students. But people want change at the gut level. And so I said, what negative thought do you want to work on first, Melanie? And she said, she'll tell other people who will judge me. And she believed that 100%. And you could even see the shock in her face when she said that thought. Now, what a recovery circle is it's a circle, much like what you're looking at right now. And it has all these lines coming out of it. And this is a prison she's in. And as long as she believes this, she's going to feel crappy. And these are techniques that can help her crush this thought. And there's actually two recovery circles that go from 0 to 12. And as a group, we came up with about 17 methods. Now you say, why would you have so many 17 methods? Well, we don't have 17 methods. I've developed roughly 140 techniques to crush the negative thoughts that cause depression and anxiety and relationship conflict and habits and addictions. And but we don't know which one is going to work for Melanie. So we want to, or for you, for that matter. So what we want to do is, take one thought that you want to work on first, and just say, here's 10 or 15 or 20 techniques that would help us crush this thought. And that gives two messages to the patient. Number one, it's that we know it's going to be tough. We're not trivializing using methods to change the way you feel. After all, she's an intelligent woman. She's been in hell for 9 years. And if it was easy, she would have figured it out by now. So it says we're going to have a lot of firepower to blast this thought out of the water. But it gives a second message too, and that message is, but we have more firepower than you're ever going to need. And that creates feelings of hope and confidence and excitement, because most patients, they've never heard of a downward arrow or examine the evidence or the shame attacking exercises or the feared fantasy technique or externalization of voices and so forth. So it's a great idea. And then we also introduce the idea to the patient that I call, failing as fast as I can. Since we don't know which method is going to work for you, Melanie, we may have to try and fail with these techniques before we find the one that works. And the faster we fail, the faster we'll get to the technique that opens up new worlds for you. Would that be okay with you, Melanie? And I've never had a patient disagree with it because it makes common sense, but it also helps her and you, because a lot of the methods won't work. What works for Mary won't help Paul or Hussein or whatever. We all have our own path to enlightenment. And what we're trying to do here is we do not want to make Melanie feel slightly better. Absolutely not. We want to blow this problem out of the water. We want to bring her to an experience of enlightenment. That's our secret agenda. We haven't revealed that to her yet.
The other thing I like about the recovery circle is that, first of all, I like the idea that we are writing these things down, that the patient actually, this is not mystical and magical, and I'm not healing my patient just by being in the room with them. Like, I'm actually using specific tools that are going to help, or techniques that are going to help them get better. And that also means that whatever we know actually worked in this situation, if I'm working with someone, for a series of weeks, like, these are methods that they get to know, and they think, oh, can we do, externalization of voices again? Oh, maybe we can try the feared fantasy. They kind of leave therapy with a toolbox, right? Just like we teach therapists a toolbox. As a therapist, I'm teaching my patient kind of a toolbox, and a way that they can help themselves to continue to get better even once therapy is done. So we were going to share with you all the first method that we oftentimes use with patients is called identify the distortions. And actually the kind of new spin on it is explain the distortions. So I think, David, when you first developed this method, it was just identify the distortions, where the patients had a long list of cognitive distortions with definitions for each of them. And we would kind of identify which distortions exist in each thought. But now we have the patient not only identify the distortion, but actually explain to the therapist why that distortion exists in that thought. And in so doing, we kind of, the patient already starts to untwist their thinking, and we can kind of show you how that works, right? So we'll do that with one thought here, right? So Melanie had the thought, she'll tell others who will judge me. So she was worried that this churchgoer would tell other people in the community about her, this being her.
And then they'll tell others, and pretty soon her reputation will be ruined and her life will be ruined. And this is the key belief in social anxiety.
Yes. And so we would, on the daily mood log, we have on the backside of the daily mood log the list of cognitive distortions and all of their definitions. And so we can give that to our patient and ask them to take a look and to figure out what distortions exist in that thought. And oftentimes thoughts will have many cognitive distortions. So we were going to do that as an exercise with the group today. So you have this thought, Melanie has this thought, she'll tell others who will judge me. So you can write in the chat box, what distortions do you see in that thought?
Okay, one has come up already, fortune telling, and I'll explain why that's a distortion, although we would have the patient do this. And that's down here, the lower left, fortune telling. She's making an arbitrary prediction, a dogmatic prediction about the future. And none of us can tell the future. And that's what the distortion is. Are there other possibilities?
That's the one that many people wrote, fortune telling and jumping to conclusions and mind reading. But we also have one who said all or nothing thinking. And we might, if it were Melanie, we'd say, great, why is it all or nothing thinking? And this person said all or nothing thinking because she's imagining that, this person will tell everyone and then everyone will judge her. Like, it's black or it's white, right? No one
Yeah,
knows and it's a secret, or everyone knows and I'm destroyed.
yeah, that it'll go from all to nothing. That it's, people have, on-off switches about whether they care about you. And as you mentioned, also mind reading, she's imagining what this woman is going to think and what other people will think. Last Friday, I did this office hours, which was a beautiful event. We'll probably do more of them. And it just went great. People were beautiful, and some of them came on screen, but one person came on and started sobbing uncontrollably, and I was kind of taken aback because it wasn't a live therapy thing. It was just a question answering thing, and I felt like I hadn't handled it very well. And I had the thought, oh we had such a beautiful office hours, and now everyone will think I'm a loser because someone came up and started sobbing uncontrollably. Uh, and then I was interested. One of my colleagues the next day said, it was such a beautiful thing, and that one woman, that you look so human and real, and I felt so close to you, and it just made the presentation that much stronger. So I was doing the same thing that Melanie was doing. What are some other distortions that they're seeing here, Jill?
I see magnification. Someone said magnification.
Yeah, absolutely. Blowing
Right.
things out of proportion. Yeah, as if the whole world is depending on Melanie and how many marriages that she's had. We think we're so much more important in a way than we really are. What's this one? Emotional reasoning, Jill. What someone
Yeah,
said
because
that.
I
How does that work?
feel right. It's this idea like because I feel badly, because I feel judged, that means everyone will judge me. Or because I feel ashamed, that means everyone is going to judge me.
Awesome. How about should statements? How someone says this is a hidden should statement. What does that mean?
I think in this one, maybe the hidden should would be they're imagining like others shouldn't judge me.
Yes, and
Or
but also I should be perfect.
right. I was thinking it could go either way, right? Like
Yeah.
imagining hostility and angry about it. Others shouldn't judge me. Also thinking I should be perfect. I shouldn't have any failed marriages.
Yes, and I shouldn't ever have anybody judge me.
Yeah.
How can
Right.
I live if one or more people are judging me?
Totally.
Mm.
Someone
But
actually, I'm glad, refreshingly, someone said discounting the positives, right?
yeah,
She's discounting there's so many positives to Melanie as a human being, as a therapist, as a community member, a churchgoer, a mother, etc., a friend, and she's only focusing on this one piece, right?
yeah, mental filtering and discounting the positive. And if we had time, we could do a survey. How many of you were judging Melanie? Or if we had time, we could do it at the end. I know my heart just went out to her. I've always loved Melanie and just felt so proud to have her as a friend and member of our training group. And and it's so sad that she sees herself as quite negative, and she sells herself so short, and then she sells the rest of us short as well, thinking that we're lacking in compassion or acceptance.
Right. And then people said self-blame. And as if it's her fault. And I think to your point, David, there's some other blame too, because you're kind of imagining others as totally
Oh yeah,
judgmental, you know.
yeah, yeah,
People
right.
don't always pick up on that actually fearing or being convinced that others would judge you is kind of a put down to the others too. It's
Yeah.
like that you see others as judgmental and incapable of compassion, which does no one else any favors either.
This identify and explain the distortions allows you to get your foot in the door, particularly if you've done great positive reframing. It doesn't always lead to a killer positive thought to crush the negative thought. Sometimes it does, but sometimes it just opens up the patient's mind, and you need to have more techniques before she can crush this. Uh, you want to do the poll, Jill?
Yeah, sure. So we're going to move on to another method that we're going to share with you, and we're going to share a video with you as well. But first, we're going to ask you, to answer this poll for us. So let me run the poll.
And this is called the double standard poll. We want to find out how many of you operate on a double standard.
So
You know,
I launched the poll. So you guys, a couple people who are maybe not on a desktop or a laptop, we're having issues seeing the poll. That's okay. You're not missing anything major. We're just asking you these 2 questions. So if you can see the poll, please answer it for us. Do you beat up on yourself when you fail or fall short? Yes or no? And do you beat up on friends or loved ones when they fail or fall short?
yeah, well, this is pretty revealing. Beating up on yourself, at least 90% of our people are saying yes to that. And do you beat up on friends or loved ones when they fail or fall short? And 83% of you, more than 80% of you are saying, no, I don't do that. 17% of you are saying, yes, or 12, yes, I do that. So you can see there's a kind of double standard among the audience right now. The majority of us beat up on ourselves when we screw up, and when a friend or loved one screws up, we treat them with warmth and compassion.
Right, which is suggesting that many of us have, if you answer those questions in that way, that means you're having a double standard, right? You hold yourself to a certain standard, but you don't hold others to that standard. And so we're going to share with you guys one of our favorite methods, at least one of my favorite methods, that's called the double standard technique. And this is a method that really helps to transform compassion that one might have for others into compassion for the self. So this is a
And
method that's great to use on people that you know are loving and compassionate and caring toward others and quite hard on themselves.
And we do it as a role play technique, which gives it massively more power than if you just intellectualize this concept to people, as you're going to see in this jaw-dropping video.
So the setup for the double standard technique then is that the therapist is going to play the role in this role play. The therapist will invite the patient to do the role play with them. And the therapist will play the role of the friend / clone of the patient, meaning they're saying, I'm going to be a friend or clone of yours, or a friend of yours that is actually a clone of you, meaning that I grew up in the same family that you grew up and went to the same schools that you went to, and I'm struggling with the same issue that you're struggling with right now. And the patient gets to play the role of themselves. And the therapist is going to ask the patient for help, but specifically for help with this negative thought. Like I keep telling myself, and you'll see it in the video, and asking the patient in the role of themselves, what do you think? Does this make sense to you? And then as the patient starts to respond, and kind of challenge the negative thought, the therapist will challenge the patient, kind of hold their feet to the fire. Do you really believe this? Or are you just trying to be nice to me? And you'll see us demonstrate this with Melanie in the video.
And this was with Angela Crum, who was with us that day, and several of us were working with Melanie, demonstrating different techniques. Angela's at the Feeling Good Institute, and so I had asked Melanie, do you want to now start out with a gentle method or an aggressive method? And she said, gentle method. So Angela said, let's try the double standard technique. So let's see what happens and watch carefully.
It's also, you get to see David and I and Angela about 17 years ago, 15 years ago.
Well, how about double standard?
I like it.
And you want to do that?
Sure, I can sure try.
Okay.
Melanie, first of all, are you open to trying this technique? Does it feel okay for you to go into this one? Okay, great. Well, I want to ask you if you could try something with me. And what we'll do is that I'm going to ask you to imagine that I'm a good friend of yours, a dear friend. And in fact,
Named Angela.
yes, named Angela. But in fact, more than the Angela, I'm so similar to you in my experiences. I grew up in a similar environment, and I had most of the same life experiences and the same value system. And would it be okay if I talk with you for a minute, Melanie?
Sure.
Okay.
Sure.
Melanie, I was wondering if you could talk with me because I've been struggling a little bit with feeling embarrassed and ashamed because I have this piece of my history that I haven't shared with a lot of people, and I'm going to tell you now, but again, I'm just feeling really embarrassed and ashamed about it because I'm worried that you'll judge me and that other people will judge me too. And you see, I'm actually in my third marriage, and I do feel ashamed about that because even though I'm so happy in this wonderful marriage now, I have this history that, maybe it means I'm defective or that, I failed or that men discard me and leave me on the side. And I'm just really concerned right now, and I'm wondering what you're thinking about that.
Mm-hmm. Well, first of all, I'm just really honored that you're able to come and share that with me. I can imagine how painful that is. I've been divorced myself, but I can understand what that pain is like. But I just want to share with you that I think we're all human and we make choices in our lives, and sometimes they may not be the right choice, or maybe they were the right choice for a moment and then things change. But I think what's really more important is that when you realized it was not the right thing for you, that you were smart enough to do something about it. And that takes a lot of courage. So I respect you tremendously for being able to make a change in your life, because you seem happy now.
Well, thank you. And that's really nice to hear. But I'm concerned you're being very nice to me now, but won't people judge me? Won't people, when I share this with them, go out and gossip and tell others and lose respect for me?
I think more people than not will not judge you that way, but there may be some that do. And that might be uncomfortable for you for a moment, but I think what you have going for you is that you're the one that's going home to somebody that loves you and treasures you, and you've got what it takes to go out there and get yourself another man. So let them go talk and let them go home and sit on their butts and watch TV and eat popcorn and get fat.
So you're telling me it's okay if some people do judge me, if there's a handful that are harsh about it, that I should be okay with that?
Well, I'm not saying be okay with it. I don't think a person ever fully feels okay with people making judgments, but I think that they have an issue. They have an issue if they're going to judge you. And I just see you as somebody that's so ethical and accepting and caring that the way you respond to them is going to model what they should be more about.
That feels pretty good to me to hear you say all that, and I'm actually feeling a lot better. But I'm wondering if you're just kind of saying this to make me feel better, if you really mean it. I mean, maybe you're just a nice person and you're just being kind to me because you feel bad for me or feel like I'm this poor, pathetic person and you have to cheer me up. Is that what's happening right now?
No. I feel badly if I'm giving that signal, if it's coming across that way, but it's not, not at all. And I guess I just see you as somebody that can go out there and find another person that you're happy with. And that's really what it's about. You went after your happiness. And there are going to be naysayers out there. And you will be uncomfortable sometimes. But I think secretly they're jealous.
Interesting.
That was a really powerful segment there. I saw that some people were having trouble with audio. Did that get fixed?
I just saw one person had difficulty, actually.
Okay.
Yeah,
great.
which is not bad for 1,000. 1 in 1,000, we'll take it.
Yeah. The one thing that to notice here is that how long did it take?
Standard.
Sorry, one sec. Hold on. I was trying to move to the next slide if you want.
Yeah. So you just saw something very dramatic. How long? And I'll show you how to bring it to closure. But what was Melanie powerful or weak in her answers to this negative self?
Powerful.
Yeah, powerful. And then Angela upped the ante and kept yes buddying her, and Melanie blew her out of the water dramatically on 3 separate occasions. Now that was real. I mean, we call it a role playing technique, but it's not role playing in the sense of pretending to be someone else. It's Melanie defending herself from her own harsh and negative thoughts. And you saw her recover there in approximately, maybe, say, to be generous, 15 seconds. It took her less than 15 seconds to completely crush that thought that she'd been struggling with for 9 years. Now, how did this happen? Did we arrange an actress or something to make some impossible thing seem true? No, this is just a real person struggling and real therapy and real time. And I don't know how to see you folks' hands, where I would just ask the question, what caused her to recover so fast? But I'll answer it for you, or you can think about it for a moment, maybe put something in the chat. And we'll have to measure and make sure she's recovered and test her out and do some other cool things. But assuming this is real, which it is, I mean, is this what you see in your clinical practice? You take a history with someone, take a negative thought, ask them to challenge it, and suddenly they flash into recovery and beyond? And empathy, no, was not it, the thing. That's a great guess. And a lot of people wrongly believe that empathy causes change, but it doesn't. Carl Rogers believed it did, but research in therapy and real life and with our app indicates it doesn't have healing power. It creates trust, and it's necessary and it's desirable. Yes, but once some person says you explored the resistance first, and that is the correct answer to my way of thinking. The reason we see, or I see, or so many of us see, incredibly rapid recovery now at speeds I would have thought absolutely impossible when I was a psychiatric resident. In fact, I almost never saw anyone recover even a little bit after months of talk, and getting their anger out and getting their feelings out. It's the positive reframing. It's helping the patient let go of the resistance to change and become proud of her symptoms. And the paradox is the moment she becomes proud of her errors, her failures, her sadness, her defectiveness, her shame, her negative thoughts. They lose all of their power. And that's difficult to believe, difficult to explain. You kind of have to see it with your own patients to believe it and realize that you've got magic at your fingertips now as well, once you become skilled at doing this. Well, how do you bring it to closure? Well, the PT column, that's positive thought. You see, when we have this recovery circle going and all these escape routes, that's to help her generate positive thoughts, which will have two qualities that are required for change. The necessary quality is that the positive thought has to be 100% true. And here's what she said. Melanie said, some people may judge me. And she said she believed that 100%. So I had her write that down right at the end of that role play. Most people will see the beautiful parts of my personality. She believed that 100%. She wrote that here, the percent belief of that positive thought. And those who judge me will make themselves look bad. She believed that 100%. Okay, that's the necessary condition for emotional change. The sufficient condition for emotional change is that her belief in that negative thought will go down drastically. And she'll tell other people who would judge me 100%. And then how much do you believe that now, Melanie? Next slide.
Sorry.
And she said, I don't really believe that. That's down to 35%. And then I said, and now, Melanie, is that low enough? Or should we try to push it all the way to zero? And she said that's low enough because there will be some people in the church and maybe some colleagues who will judge me because I'm in my third marriage, but now I'm not threatened by that at all. And if they're judging me for that, I now see that that's more of a problem for them than it is for me, although it's sad because maybe it's somebody that I won't be able to develop a close relationship with, or at least not easily. But it's not a threat to my self-esteem or happiness anymore. Now, one of my heroes was Albert Ellis from New York, called the father of cognitive therapy, which Beck likes to think of himself as. And if you call Beck the father of cognitive therapy, well, he got it from Ellis. So we can call Ellis the grandfather of cognitive therapy, and Beck was the father. Maybe I'm the son, but I think I was kind of a bad child, I'm afraid, because I got kicked out of the family when my book Feeling Good became popular. But I'm glad I was. It led to some good new things being developed. But
You're
one
the
thing,
guru, David.
huh?
You're our guru.
Yeah, right, right. Yeah, yeah. Funny things happen when you get old. It's kind of good shit, really. But at any rate, Ellis, I loved him. He was a character, and he was tremendously original in his thinking. He was outrageous as a therapist, and but he had a lot of great ideas, and I just loved him, in spite of all of his many flaws and human aspects. But he often said that you've got a low level solution and a high level solution. And he said, in a low level solution, you find happiness because you realize that your distorted negative thoughts aren't valid. And that's what just happened to Melanie. She discovered, and of course, she has to test it with exposure, but it's very unlikely that there's going to be this big movement against Melanie because people find out that she's had that she's in her third marriage. But that you may still be dependent on getting everyone's approval. You may still be kind of perfectionistic, and you may still have all those attitudes which could set you up for future misery. And so a high-level solution is if you discover that you could still find happiness if your worst fear came true, and people really were as harsh as you think they are, and they really did start judging you. And in fact, they get right up in their face and they say, I judge you because you've had 3 failed marriages, and I'm deeply religious, and people in our church, we're not heathens like that. So, some such fantasy that she was worried about. And so what we're going to do now is, with her permission, you have to have be open and honest and get collaboration. But we're going to invite her to do a technique I created called the feared fantasy. And in the feared fantasy, you go. We're going to take her to the church from hell. And in the church from hell, there's 2 weird rules. And one rule is, if you think people are judging you, they really are. And unlike the real world, in this church from hell, they're not polite. They don't hide their feelings. They get right up in your face and try to humiliate you by saying the awful things about you that they're thinking. And if you can handle that feared fantasy monster, then you're catapulted into true enlightenment.
So I'll cover the roles. Again, it's a fun role-playing technique, although can be anxiety-producing for our patients. It also brings about really meaningful change. And in this, the therapist is going to play the role, as David said, of, in this case, kind of the church member from hell. So basically the judgmental other, right? Depending on the context. In this context, the church member from hell. And Melanie gets to play the role of herself. But also, if the patient gets kind of stuck, right? If the therapist is playing church member from hell and patient gets a little stuck like deer in headlights, you can do a role reversal. The therapist can play Melanie, and Melanie can play the church member from hell, and we can kind of keep taking turns until we can really blow that thought out of the water, until we can reach kind of a laughing enlightenment, I think, is what you'll end up seeing here in the video. So let's watch the video.
I knew that this would probably be good for me, but I had a lot of anxiety about it. But just being able to say it. But right now I'm going through periods where I'm feeling really empowered, and then you'll say something else and boom, it's like it.
Isn't that amazing? And it seems so real, doesn't it? And it's like, oh no, they had me conned into thinking things were okay, but I better remember that I'm defective. I've had 3 marriages. This word is going to get out now.
Right.
I'm this horrible person, right? Something like that.
Is that what's happening? You're kind of drifting in and out.
Yeah, I'm drifting in and out.
And what's the thought now that's...
that the reality that it never really will go away. It's going to be about working on my anxiety to get that down, because the reality is there's always that possibility there will be someone that has an issue with it, and there'll be a lot of people that don't. But I like
Let's
what
go
you
right to
said.
feared fantasy, and then
Okay.
we'll come back to externalization of voices.
Okay.
Do you know who I am?
Yes, you're Melanie.
No.
Uh-oh.
Now we're going to be the
Oh.
critical. Now
Oh,
we're switching
you're my
to
okay.
feared fantasy.
Okay.
Yep.
So
Now we're going
Okay,
to
my
go into an
critic.
Alice in Wonderland nightmare world where your worst fear is going to come true. And in this nightmare world, there's two weird rules. We're going to go into the church from hell. And in the church from hell, there are these two weird rules. The first rule is that when you think people are looking down on you, they really are. But not only that, they get right up in your face and they say the things they're thinking about you that most people would never verbalize. Are you ready?
I'm scared.
I don't want to take you against your will here.
You know what I've realized now? I guess there's another part of what I didn't realize I was afraid of. And that is my anger. I'm afraid I'll get ballistic with them.
Well, you can do that too.
Depending on what they say.
Okay, well, let's see what happens.
I don't want to.
Which role? Do you want to be the churchgoer from hell, or do you want to be Melanie?
I'll be the churchgoer from hell.
And you want me to be Melanie? Yeah, that's good. That's good. I'll be Melanie, and then we'll do role reversals.
I don't know how well I'll do it because I might temper it for my own need.
Yeah. Go ahead.
I was going to say to Melanie too, though, just to have the understanding that if it ends up if you were being Melanie and we were being the churchgoers and being critical of you, and you ended up answering it with anger, that would be a really helpful thing to have happen here, and we could then talk about. Do you want to have that angry response? Do you want to hold on to that anger? Or in fact, do you want to learn an alternative response and kind of cost benefit of the anger? So, I mean, that if that ends up coming up here, that seems like
we have many ways to slay this monster. Anger is only one of the ways. We have multiple ways to slay this. This monster is going to be pretty easy to kill. The thing you fear the most, I think, is not going to be as much of a threat as you want. But could I speak with you then
I'm going to be myself. You be the naysayers.
Yeah, well, we've been talking here, some of us in the congregation, and I've heard actually that you're in your third marriage. I didn't know that about you.
Yeah.
And I've had one marriage only. My wife and I have been married for 85 years now.
Oh, well, that's wonderful. Congratulations.
Well, we're just tremendous, marital experts, and we have very high standards. And I just wanted you to know that now that I know that you've had in your third marriage that I'm looking down on you. I didn't want to hurt your feelings or anything, but I felt I needed to be honest with you. I see you as having kind of moral failings.
Mm-hmm. Well, you know what? I have had some failings, and I'm happy that you've been married for 85 years. But to be honest with you, and this might be a little disappointing, but I'm also happy that I haven't stayed married to my first two husbands. I'm in a very happy marriage right now, and I'm a lot younger than you, so I think maybe if I can do like you and live a long life and be healthy, maybe I'll have a long marriage and I can experience the joy that you have.
Who won that exchange?
You did. I did.
Yeah.
I did.
Right.
I'm trying to hold.
Exactly. How did you beat me?
I didn't fight you back on your perceptions of me. I just
exactly.
went with
That
it.
was the secret to killing me. Now, suppose I were to come back. What could I say? Yeah. It was, you had me eating out of your hand. But what's the worst? How could I come back? What's the worst thing? What's the worst thing that someone could say? What are you the most afraid of hearing?
Well, were you some kind of whore that just whored around and maybe your husband's caught you and you just...
No, do a role reversal. I want to answer that one. Okay.
Were you some kind of whore?
I wasn't, but I am now. I've been taking lessons from Dr. Burns, my friend.
Oh, God.
Is that too tongue in cheek?
No, I guess that's kind of the worst because when people, I mean, you don't go into the reasons your marriages didn't work.
Yeah.
So I guess.
Could I speak with you for a minute, Melanie?
Yeah.
I've heard you've had several broken marriages. Were you some kind of whore, just kind of whoring around with men?
No, actually, I wasn't. I'm just curious, why would you think that I was whoring around?
Well, men must just dump you right and left.
Oh no, but they don't dump me. We agree to go our separate ways. But I tell you where you're right. They're about men, not so much that they dump me, but they find me. So I have been found by my shining prince.
Who won that one?
I think I do.
Yeah, big or small?
Big.
Right. What could we say? Here's some women in the church.
I didn't even know where she was going with that.
That was
I didn't know where I was
yeah.
going either, but
Here's some women in the church. They're rougher than David.
Yeah.
What
Can
can
I
they?
try one? Do you have something you want me to try? Or you want me to come up with
not
my own
now. I'm
worst thing?
recovering from that one.
Yeah, do you want to
Oh,
tell
you're
us what you're
recovering?
feeling?
Kind of victorious
Oh.
and a sense of relief
Oh.
because that's kind of like I always think, oh, they probably think I was some kind of whore or something. I always try to think, what's the worst possible thing that could be done that people are often judged for?
Mhm.
And that's like, I guess being raised in the era I was raised, that was always like a big thing. And I wasn't a whore, but I always fear, well, what if some person accuses me of that or whatever? I mean, you don't know what people think.
And so if someone were to accuse you of that, is that something you need to be afraid of?
No, I guess now that I think about it, no.
Why not?
Because one, I wasn't a whore. I'm not a whore. And if they would want to believe that I'm a whore, then I'll just probably want to tell their ass off.
Hold on. I'm just trying to move to the next slide, David. Hold on.
Yeah. Then go.
Oh, I think we put this next, but do you want to do this and we can go back?
Yeah. Right. Now we used many other techniques during the session. This was roughly a 2-hour and 10-minute therapy session, and so we had time to do a lot of different techniques and blow all of her thoughts out of the water. Not just she'll tell others who will judge me, but I'm a failure. Went to zero, and she brought all of her thoughts down to super low levels. And then once she's challenged successfully all of her negative thoughts, you just say, how are you feeling now at the end of the session? And you see she went from 50% sad to zero, which was her goal. On the anxiety, she thought it would be impossible to go below 40. From 100 to 40, it went all the way to 10. The guilt and shame, she thought it'd be impossible for them to go to 30. It went from 100 all the way to 10. The inadequacy went from 95 to 5. The embarrassment and humiliation went from 100 to 10. And then the last three feelings, hopelessness, frustration, and anger and madness and resentment and irritation, went from 75 again all the way to zero. And some of the techniques that that we used were on the slide that you're about to look at. There we go. And we won't go into all of these, and there were more than just these, but these were some of the main ones, the 5 secrets of effective communication during the empathy phase. You saw how we did identify and explain the distortions, the double standard, the externalization of voices, which we didn't illustrate, but we used it, and it was extremely, extremely powerful. And then you saw the feared fantasy, which included the acceptance paradox, was a big key to her enlightenment. And then we gave her a lot of homework, like self-disclosure and telling other people rather than hiding it, and putting the plaques up on the wall of your office. And then we did relapse prevention training, which takes about 20 to 25 minutes with each patient. Once they've had their first breakthrough, the probability of relapse is 100% certainty with all of us. No one's entitled to be happy all the time. So the patient needs to know what to do when those negative thoughts and feelings return. But this was kind of the blueprint for the session. And then this shows her end of session mood scores and the massive reduction. Now, oops.
Sorry.
The ones that still leave a little room for improvement is that the embarrassment went from 100 to 30, which was amazing, and the anxiety went to 10, and the shame went to 10. What will she have to do after the session? What kind of homework to get these all the way down to 5 or 0? And we'll tell you, but maybe somebody would like to have a guess on that.
We see exposure coming up and self-disclosure.
Yes, and I had her do a lot of very extreme exposure, which she's doing right now. I don't think she's in the audience now, but she, this we're telling her story in public, and she came to an intensive where I showed the video, and she was extremely proud and got a standing ovation from people. Let's push to the next. And now, how is she feeling at the end?
I felt tremendous relief when I walked out of the room that day. And if I can try to describe how I felt, before I went into the room, I felt like my heart was crying, like my heart had been having little mini seizures. And when I left the room, I felt like my heart was smiling. It didn't have that tightness. So just physically, I felt better. I felt a relief, like a weight had been lifted off of my shoulders. What I think is the reason one session can make such a profound difference is because the model is so prescriptive. It's so highly focused, and it gets to the core of the thoughts, the negative thoughts, the feelings, and the behaviors that are getting in the way. But it's mainly getting to those thoughts and exposing you to them. And you could spend months and months and months and years in many of the other therapeutic models and never, or it'll take years to get to what we did, if you ever do. If you ever do.
And I thought it was beautiful that you saw that she now has her. This was 2 or 3 days later that all of the awards up on the wall of her office.
And so David, I'm going to suggest, just because we don't have a ton of time left, if it's okay, what I'm going to suggest we do is do this sort of where do you go from here, and just share that with people, and then we can do the Q&A right up until the very end.
Yeah, great.
Otherwise, we're going to be trying to contain our Q&A, not knowing how much time we need after. Is that fair?
Yeah, let's do that. Yeah, great thinking, Jill.
So what I'll share with you guys, and then we're going to take questions until 1:00, and Mike will drop the survey in for you all in at about 5 of the hour. So if you were excited about what you learned and inspired and loved what we did with Melanie, and you'd like to learn more with us, we're just going to share a couple different things with you. The first is for therapists. If you'd like to do further training with us, we have this Fast Track to Level 3 course that's 45 continuing education credits, and it starts on June 20th. And I'll just share with you briefly. You can see on the slide, we've kind of chock full of language, really just for you to see all of what you get. But generally speaking, it's kind of a hybrid model where if you join us, then every week you do about an hour of kind of independent study. Those are videos of me teaching you skills that have been pre-recorded, interviews with David Burns, quizzes, kind of interactive things you can do on your own. And then 1 hour once a week, you join Mike, Maor, and other Feeling Good Institute trainers to actually practice the skills that you're learning. So you have an hour of practice, deliberate practice with feedback, kind of refining your skills. And that goes on for about 6 months. And signing up for the course also gives you kind of free levels 1 and 2 certification and free access to the level 3 certification and preparation for the level 3 exam. And it also includes David's awesome toolkit. So that's kind of free as well. And lastly, I'll just say that we feel so confident. We've gotten such awesome feedback on the course so far that we're offering people now a money-back guarantee. So you're welcome to join us. We know you'll love it. And if you don't, within the first 30 days, we'll give you all of your money back. And if you join today, if you want to register today, the link to register is at the bottom, the fasttrackcbt.com, and you can use this code FAST50 to get $50 off the typical registration. So I'm just sort of sharing that with you and hope people decide to join us for that. And this is just one kind of testimonial from Sarah, who's now a Feeling Good Institute therapist.
Has the feared fantasy exercise ever gone horribly wrong?
Everything in the universe goes horribly wrong much of the time. And that applies to all techniques and all schools of psychotherapy. And that's why it takes a lot of training, probably more training with TEAM than with any other form of therapy. That's why we offer unlimited free psychotherapy training in TEAM, because a technique powerful enough to get a transformation of a patient in a single therapy session, if done unskillfully, has the power to hurt as well as the power to heal. And so this requires, it's a blessing to have powerful techniques, just like a surgeon's scalpel and anesthesia can remove a ruptured appendix in a matter of minutes and save someone's life and get them out of horrible pain. That same scalpel can be used by a mugger to stab someone in the liver and mug them.
Thank you.
It all depends on the compassion and skill of the therapist.
I was going to say, I do believe, though, that as a skilled therapist who knows how to use the method and kind of has good ideas for responding, if you do a kind of a role reversal, I really haven't found it go terribly wrong. So a lot of it depends on, again, empathy, agenda setting, therapist practice.
Yeah.
I'm just noticing that Mike is getting ready to wave. We do have to end on time. Some of us actually have 1:00 patients, if you can imagine. So we're going to say goodbye to everybody. I want to say a huge thank you to you, David, for not, inspiring the model, developing all of this, and sharing so generously with all of us. And it's always a joy to present with you. And also thank you to Mike for helping us to facilitate the training today.
Yeah, thanks, Jill and Maor and Mike and all of you who joined us. We love you all, and we're going to try to start doing more of these free events for the general public and therapists. Let us know if you like them, and you're talking, we're listening.
Okay. Thanks, everybody. Have a great day.
Bye-bye.